week 2 overview. Our course objectives are as seen on the screen. Remember that we want to contribute as a member of the healthcare team to healthcare activities. Think about those to promote and maximize individual health and wellness. We want to be able to identify those resources that are in the community that helps the person individualize specifically to meet their needs. We always want to use that nursing process, critically thinking. That nursing process is that structured way so that we can critically think and not lessen the chances of missing something. And it also helps us to problem solve in a safe, effective way. So the concepts for this week is school nurse, growth and development, common childhood elements, family nursing, and family health risks. Your required readings are as listed on the screen. Ensure that you have the correct edition. And if you do not have the correct editions for this course, contact your campus dean. But specifically in this book, you should be able to find information regarding asthma on the pages that's listed here, and then so forth. The fundamentals, concept, and skills for nursing. Look in these chapters. And then the mid-surgical nursing, you want to look on page 1024. So ensure that you have the correct edition of your books, and it should align with these weekly readings. Okay, let's go ahead and talk about the school nurse. Now, you do have this information in Canvas and in your books, but I will just narrow and just give a good overview of the concepts. School nurses play many roles. You have many hats. You're that direct caregiver, providing care for illnesses and injuries. You're overseeing self-administration of some medications, because some students, they can have the paperwork completed and they have been taught and they can self-administer, but you just have to oversee it. You are that health educator, providing health information about growth and development, puberty, substance abuse, prevention, hand hygiene, acute illness prevention, diet, exercise, obesity prevention and treatment. You're that consultant, providing health information to teachers, school administrators, to parents. You'll be called to speak at the PTO or the PTA meeting, the Parent Teacher Association. You'll be brought in, asked to attend the students' IEP meetings, the individualized education plans, and to give your insight. You are also that case manager in children with complex chronic illnesses. The school nurse may coordinate care among other providers. Some of the students may be receiving speech therapy, occupational therapy, or even dyslexia therapy that occurs during the school day. So the child receives those services while they're at school, and you have to coordinate, identify where that child is, and coordinate those services being provided to that child. You're also that community outreach person, participating in health fairs or festivals, because many times the schools, they have different activities all throughout the school year, and even during the summertime. You're coordinating with volunteers or other organizations to bring education or programs to the schools. Now, I do know in our area, we did have a partnership with a company that came in and did actual eye exams. Not only did they do the eye exams, if the children needed eyeglasses, they provided that for those students. So let's talk about prevention in the school. So primary prevention, preventing a problem before it ever occurs. We're providing education on prevention of childhood injuries. So seatbelts, helmets, playground safety, which includes assessing playgrounds for safety. You have to actually go out and look. You have several students coming in and their knees are scraped or they keep bumping their heads. So you need to go out and look and see what is that equipment. Is it in need of repair or removal? Could it be that the Some education need to be provided to the students and the teacher. Prevention of sports-related injuries in conjunction with parents and coaches. Concussions is that big thing. We want to ensure that our coaches and everyone on that staff is CPR certified, which they know it. So many times you as that school nurse, you may be a CPR instructor. So they'll come to you and they may come to you just to get their practice in because you may have those mannequins where they can practice. Prevention of substance abuse behaviors. We want to provide education early on the effects of substance abuse. The earlier, the better. Provide education on appropriate coping mechanisms to reduce the risk. We want to improve awareness for teachers, parents, and community members on substance abuse, those fads, those trends, and dangers. So we want to identify and inform them of this information early on. So the earlier, the better. We want to reduce risk of disease. So immunization requirements and suggestions. As a school nurse, many times you may have to coordinate immunization clinic. I can remember it was years ago where I want to say it was a DTaP. I'm not sure which immunization it was, but because of evidence-based information, they decided that there was a second dose of that vaccine was needed. So they identified those students. Those students, I believe at that time, were in the 6th grade. So, of course, they had to have parents' permission to give those immunizations. Many parents were there. And the parents also had the opportunity to get that information and seek care on their own. They could take their child to the doctor themselves and get the immunizations, in that setting. Many times you will coordinate flu vaccines and COVID vaccines for the staff. You just will coordinate and be the person that's talking to the business or the health department that's going to come in and actually provide those. All states allow medical exemptions from vaccines, and 47 states allow physiological or religious exemptions. Immunizations decisions belong to parents and should be respected. Nurses provide evidence-based education and avoid shaming. Flu, COVID prevention techniques, you'll provide education about that, diet and exercise, lifestyle, to reduce the risk of chronic illnesses. Get up and move, that was a huge initiative. Healthy People 2030 objective, reduce the number of schools selling junk food. So I know in our school, they changed everything in the vending machines. When I say everything, everything. The Cokes were still in there, Sprites were still in there, but it was Coke Zero, Sprite Zero, Powerade Zero. They pulled all that stuff out that was considered junk food. And then students, once they, they got used to it, they didn't have a problem with it, but initially everyone was complaining. Where allowed, sex education for prevention of STDs and unintended pregnancies. Healthy People 2030 objective. If directly questioned by a student, you can discuss contraception, emergency contraception, and etc. If directly questioned. Children, adolescents have reproductive rights, and parental consent is not required in response to direct questions or requests. When providing education, always keep the child's developmental stage in mind. So think about it. We're talking about seatbelt safety. So think about it when we're talking about a 6-month-old or 9-month-old or a 5-year-old or 18-year-old. That information is that conversation will be a little bit different. For the 9-month-old, of course, we're not talking to the 9-month-old, we're talking to the parent. So for the 18-year-old, we want to consider what distractions will they have, while they're driving, what things will prevent them from actually putting on that seatbelt. So we want to consider the age when we're talking about any type of intervention. When providing education, always keep the child's developmental stage in mind. The younger the child, the shorter the education should be. Use lots of pictures, examples, consider toys or stuffed animals because they learn best through play. Secondary prevention, screening for early identification and early treatment of a condition. Common complaints: health, headaches, stomach aches, fever, sore throat, cuts, bruises, sprains, anxiety, rashes, itching. Will These are all some common complaints for in the school setting. Children are likely to have somatic complaints related to physiological issues. Chronic or frequent headaches, stomach aches require investigation into bullying, anxiety, depression, sexual abuse, physical and emotional abuse. So you'll have a child that may come to you, every day or every other day, but they'll come to you pretty often. And you use the nursing process, you use that structured process, and everything checks out. Everything is within normal limits. But that child still comes to you and complains of whatever it is, that stomach ache. So you need to further investigate or ask those open-ended questions to ensure that that child is not being bullied, that there is no sexual abuse or physical or emotional abuse, any anxiety or depression is going on. Screening for potentially contagious illnesses and notifying parents. So we will screen for lice. Many times, children will have signs and symptoms of conjunctivitis, chickenpox, the flu. And so what you do is, we can't diagnose, but in the event that, the child really does, after you're doing your head to toe assessment and the child do have signs and symptoms of whatever, we do want to advise that parent to take them to the healthcare provider for a full evaluation if we don't diagnose. Okay, for example, if we have a child that, comes in, they even have signs and symptoms of diabetes, they have that excessive thirst. They have that appearance on the skin, but still we don't diagnose. We would advise that parent or guardian to take that child for that full workup. Screening for child abuse, neglect. Nurses are mandated reporters of child abuse. Presence of abuse, neglect greatly increases the future risk of mental health disorders, increases the incidence of suicide, substance abuse disorders, unintended pregnancies, and STDs. As a school nurse and as a secondary prevention, we will do vision and hearing screenings, scoliosis screenings, identifying bullying to identify risk for mental health disorders, suicide, violence towards others. Bullying is at the center of most school violence, either at home or at school. Screening for these behaviors and intervening can prevent violence towards self or others. Children need mental health services as early as possible when they are facing such adversity to improve their coping mechanisms, to improve their emotional and mental development, and to prevent long-term consequences. Okay, so let's talk about some tertiary prevention. This is treating and managing an existing condition. So we talked about primary prevention, preventing a problem before it ever occurs, providing that education. We talked about secondary prevention with screening for early identification and early treatment of a condition. And then now let's talk about tertiary, treating or managing an existing condition. Some examples are medication administration. We must have that original label on the original container and must have a signed parental consent, that doctor's order, include that prescription, no matter what it is, including over-the-counter medications. It is a PO medication by mouth, is an inhaler, insulin, over-the-counter medications, or vitamins. We must have the original label, the original container, a signed consent, and a prescription. Tertiary, another intervention is case management. Participate in IEP development, coordinating occupational physical therapy, suggesting classroom setting changes to accommodate a child with a chronic condition. Teaching students, parents, and teachers how to manage chronic illnesses such as asthma. Helping that child identifying those triggers. And it could be something in that classroom. I don't think classrooms still use chalk, but they may have some type of irritant in there. So identifying those triggers and removing them, providing suggestions for removal. providing education about diabetes, allergens. Children are at higher risk for type 2 diabetes than ever before, along with risk of type 1 diabetes. We'll work with those pregnant adolescents to maintain that healthy pregnancy and that healthy school environment. Our long-term goal for them is to finish that education. Family nursing and family health risks. What is family? Whatever they say it is. Family is the people who provide physical, emotional, financial support. Non-traditional families are the norm now. What is a healthy and functional family? There are 5 functions of a family: financial, health, reproductive, socialization, and affective. So financial, planning for the future, making good financial decisions, providing housing, insurance. Health, teaching healthy behaviors, teaching health maintenances, providing informal caregiving. Reproductive, perpetuating of species. Socialization, raising children to fit into society, to become productive, responsible, well-adjusted adults. Passing on spiritual, religious, and cultural beliefs. And then affective, creating a sense of identity and belonging through affection, love, time together, fellowshipping, and bonding activities. Failing to meet these functions leads to dysfunction, strife, and crisis. Some common childhood ailments. We have asthma. That's where there's an increased responsiveness in the airway. There's a strong tie to genetic predisposition and allergies. Eczema, the atopic dermatitis, is a chronic immune-driven inflammatory condition of the skin. Type 1 diabetes, autoimmune destruction of the pancreatic beta cells leading to insulin deficiency. We have acute conjunctivitis. That's inflammation of the conjunctiva, the mucous membrane that lines the eyelids, commonly called pink eye. Scabies is caused by a parasite that burrows under the skin and lays eggs, and it causes that intense itching, especially at night. Clothing, bedding, and stuffed animals should be washed and dried with high heat. Non-washable items can be bagged for at least a week. Mites die within 3 days. And it spreads by direct contact, person to person, or indirect contact by sharing bedding, clothing, that just coming in contact. So everyone, even the babysitter, even the aunt that came over to drop off whatever, everyone must be treated. Head lice. These are lice, the louse lies, nits near the base of the hair shaft. Nits and adult lice are seen in the hair, easily transmitted through to others by sharing combs, hats, hairbrushes, person-to-person contact in the school and daycare setting. ADHD, inattention, distractibility, increased gross motor activity and impulsivity, usually associated with underperformance in school setting, not related to a learning disability, just due to symptoms. They may have low self-esteem and poor interaction with others. It's treated with oral medication, coping skills, placing the child in the front of the classroom, giving clear, short directions, provide those rest breaks. Do not limit outdoor physical activity. Tutoring may be helpful. Iron deficiency, anemia, more likely in infancy and adolescence due to growth spurts, can be related to iron deficiency in the mother during the pregnancy. Long-standing iron deficiency anemia can slow the growth and cognitive development. So vitamin C improves iron absorption. So incorporating vitamin C containing fruits and fruit juices with meals help. High iron foods include liver, red meat, egg yolk, dark green leafy vegetables, dried fruits, dried beans, and iron fortified cereals and bread. Scoliosis is that S-shaped curvature of the spine. Symptoms develop slowly and are not typically painful. One shoulder will be higher than the other, one scapula more prominent, arm to body spaces may be unequal. One arm may appear longer than the other when bending forward. Screening should be done before middle school, performed by observing the back, shoulders, and arms, and the hip while the child stands in front of the nurse and bends forward. Lead exposure. Lead is present in paint that's made or applied prior to 1978. As paint chips away, chips are inhaled or orally consumed by those exposed. May also be present in soil since it was freely released into the environment prior to the 1978. It is also in lead plumbing materials that were used before. Lead levels in Americans have been declining for years. We used to test lead levels in all children. Now we do that screening questionnaire, and based on those answers, we do that lead testing. In children, it is associated with developmental and cognitive delays. Higher lead levels are associated with headaches, abdominal pain, constipation, clumsiness, agitation, and can lead to a stupor and seizures. Treatment includes removing the exposure. Children should not be present when paint is removed through sanding. It should be done by a professional that has adequate PPE, and chelation therapy also may be used. Unfortunately, treatment does not usually reverse the cognitive delay, but does prevent further decline. So let's look again at our week 2. So our required readings, we looked at those, our activities, and then you have an assignment, a week 2 discussion that's about common childhood ailments. And then in week 2, you will also take quiz 1.